Hey, what's up guys? It's me, the PsychiatricNPDavidC. So walking into your first psych appointment can be kind of intimidating. You're probably wondering things like, what are they gonna ask me? Do I need to tell them my entire life story? Are they gonna slap me with a diagnosis right away? As a psychiatric nurse practitioner, I've seen this nervousness from almost all of my patients. So in this video, I'm gonna walk you step by step through what actually happens in your first appointment with a psychiatric nurse practitioner or a psychiatrist. I'll also be explaining the differences between an in-person appointment versus a telehealth appointment. You'll know what to expect and how you can prepare so you can walk in feeling confident instead of anxious. Let's talk about it. If you're doing in-person, you're probably going to be either at an office or clinic. If you're doing telehealth, then you want to be in a quiet, private area so you and your provider can have an engaging and confidential conversation. The first thing they'll have you do is probably fill out a bunch of paperwork. This includes things like insurance, consent forms, HIPAA, things like that. It's perfectly normal to feel nervous at this time because you're about to meet a new provider for the first time, but just know that providers want you to feel comfortable. It's not supposed to be an interrogation or anything like that. To be honest, I even feel nervous before meeting a new patient for the first time. So the nervousness often goes both ways. Now, if you're doing telehealth, instead of waiting in a lobby, you're going to be sent a secure video link. Try to make sure your camera and your microphone work before you join the link. A good thing about telehealth in this situation is that you don't have to drive anywhere, and you don't have to awkwardly wait around in a lobby full of people. So next up is meeting your provider. So the provider will introduce themselves. For example, when I see a patient for the first time, I'll be like, hey, my name is David. I'm a psychiatric nurse practitioner. How you doing today? I like to throw in a couple icebreakers or like small talk because it eases the tension a little bit. I also let my patients know that everything we discuss will remain confidential between us, unless something they say is either a danger to themselves or a danger to others because I am a mandated reporter. I try to give like, oh, we're on the same team vibe because we are. If you're doing telehealth, before I say anything, I'll make sure that the patient can hear me and see me. Your provider might also want to confirm your location just in case of a crisis or emergency. Telehealth appointments can feel more casual since you can join from pretty much anywhere. So after the introductions comes the history taking. So this is the bulk of the appointment. There's many categories that we need to ask about. The first category is the presenting problem, which pretty much means, why are you here? I've had patients say they came to me because they switched insurances or their therapist just recommended that they start on meds. I even had one patient literally say, I don't know. Whatever you end up saying is going to end up being your chief complaint, which is a fancy term for your reason for visit. After that, we'll ask about your psychiatric history. This includes things like past diagnoses, past medications, current medications, past therapy, current therapy, things like that. This is important information that we use to know what stage you're at. For example, our treatment plans may be different for someone who's just starting medication management for the first time versus someone who's been on psychiatric medications for like 10 years. And next up is medical history. This includes things like diabetes, hypertension, hyperlipidemia. We'll ask if you have any allergies to medications, and if you're currently taking any non-psychiatric medications, such as pain medications, blood thinners, because there are some medications that interact negatively with psych medications. And next up is any substance use. This includes things like caffeine, alcohol, weed, ecstasy, stuff like that. This is important because substances can actually mimic psychiatric symptoms, and also they can interact negatively with medications as well. For example, if someone drinks a lot of alcohol and they're feeling depressed, it might just be due to alcohol withdrawals, and they probably wouldn't need an antidepressant. They just need to control their alcohol intake. An example of a medication interaction would be like alcohol and Xanax. They both risk respiratory depression, so if you take both at the same time, you're at an even higher risk for respiratory depression. And next up is family history. It's useful to know if anyone in your family has mental health conditions, because if they do, then it places you at higher risk for having them too. For example, bipolar disorder has a very strong hereditary component. So if your mom or dad have bipolar, then you have a stronger chance of having bipolar as well, compared to someone with no family history of bipolar at all. And next up is social history. This includes things like work, school, support systems, relationships. It gives us context for your symptoms. For example, if someone just lost their job, that might be causing their depression, so that's good to know. We also want to know if you have any protective factors. For example, if a mother says she will never commit self-harm because she has to take care of her daughter, then her daughter is her protective factor. Some providers even ask patients about their hobbies. It's a good way to build rapport and gain trust. And next up is trauma or stressors. So you can share as much or as little as you're comfortable with. To be honest, talking about trauma is more suitable for therapy as opposed to medication management. because therapy can help you reframe your thoughts and develop coping skills. But it can also be useful for us providers because it provides more context for your symptoms. And the last set of questions is usually about safety. We have to assess our patients to see if they have any thoughts of self-harm. And if we see that they're actively a danger to themselves, then we have to report it. Keep in mind this history-taking section will vary from provider to provider. Some providers may want to go more in depth, while some providers may not. But generally, your provider should be asking you these sets of questions about your history. So while your provider is asking you all these questions, they're most likely doing their mental status exam at the same time. This is when they're observing things such as your mood, body language, speech. Some of my patients will be like calm, cooperative, relaxed speech, but another patient could be like quiet, withdrawn, tearful. We observe your thought process. Do you get straight to the point? Do you go off on a tangent? Are you easily distracted by other things? Basically, it's like a physical exam, but for your mind. And next up is the diagnosis and treatment plan. For me personally, I don't share the diagnosis unless the patient specifically asks me for it. Reason being that if you label a patient with a diagnosis, it tends to stick in their mind for the rest of their lives. For example, if I tell a patient that they have major depressive disorder, severe, it's probably going to end up making them more depressed. Then we explain the various treatment options. Regarding medications, we explain to you what it is, what it does, the possible side effects, and when you can expect to start feeling the therapeutic effects of it. This is a shared decision-making process. If you don't like the side effects of a certain medication, your provider should be able to provide you with alternatives. Then we'll discuss other things like lifestyle changes, therapy referrals, sleep hygiene techniques. Most prescriptions are sent electronically these days, but some providers still use paper prescriptions. And last but not least, I always ask my patient if they have any questions or concerns before I let them go. I recommend writing down questions ahead of time because sometimes providers can be hard to reach. Some example questions are like, what should I do if I miss a dose? What time of the day should I take the medication? Should I take it with food or without food? If you're doing telehealth, some providers have an online messaging system, so you can message them with any questions that you might have later. This first appointment should take anywhere from 30 to 60 minutes. Just remember it's normal to feel overwhelmed or not remember everything after the first appointment. At this point, you already took the first step in your treatment plan. You've already met your provider. You know who they are, what they sound like, what they look like, and if they're a good fit for you. If you have any other questions regarding the first appointment, let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I also do telehealth medication management for adults living in California. If you're interested in booking an appointment with me, there's links down below. And with that, your mental health just leveled up. You're welcome.